MUSC projects the number of COVID-19 patients in our state will peak in late April and early May. News 19's Jacob Reynolds has the details on why MUSC's experts say it's too early to stop social distancing.
On a video conference call with reporters, MUSC President Dr. David Cole says the state should start planning now on how to reopen the economy.
Best thoughts on the parameters that would allow a green light on relaxing the current social distancing restrictions are as follows. 1. South Carolina hospital systems have the assets and capacity to treat patients moving forward with adequate staff, beds, ventilators, and PPE. And 2. The incidence of new COVID-19 infections needs to be and remain low. If current models hold true, these conditions will likely exist in approximately 4 to 6 weeks.
Dr. Cole and MUSC staff say they expect the state's cases of COVID-19 to peak in late April or early May. MUSC CEO Dr. Patrick Cowley says they're focused on attaining rapid tests for the disease and then developing immunity testing.
Well, think about that. If you were known to be immune to COVID-19 and we understood all the depths of what that meant, we might be able to get you back to work earlier. In healthcare and health systems, we might be able to put the right people on the front line of dealing with COVID-19.
MUSC has a team performing their own analytics and projections. While presenting their research, Dr. Michael Sweat says current measures are helping.
There is evidence that in the past 3 weeks, social distancing has reduced the growth of new cases substantially. I would say we are seeing a slight digression of that occurring right now.
Dr. Cole says to prevent a second wave of infection, the state should stage economic reopening based on priority and impact, have widespread testing, immunity testing, detailed contact tracing, and protect vulnerable populations. In Columbia, Jacob Reynolds, News 19 WLTX.
MUSC says that current projections show the state has enough hospital beds to care for a peak later this month, but said it was still too early to relax social distancing guidelines.